Describing neuroanatomical structures and their relative position to others, you need to use words that describe spatial relationships. So let's try to go through the most common words, what you will need to use. So usually we talk about something in front of us, behind us, above us, or below us. And that can be used in anatomy and specifically neuroanatomy as well. So say in here, if we look at a structure with a main axis in a vertical position, or looking at another structure where the main axis is closer to the horizontal aspect, we still can talk about in front, or in Latin anterior, behind or posterior, above, superior, and below, inferior. And that would be true for both structures. However, often different words are used. Let's go to this picture of a dog. This is a four-legged animal. The other words what can be used to describe structures and relationships is something to the back, dorsal, that's called that because dorsum means back. Could be described as ventral when it's close to the belly, as ventrum means belly in Latin. Another word is often used, rostral. Rostrum means beak, so it's close to the beak or the nose, looking at classical Latin statesmen. Often their nose looks like a beak. And the other end, the posterior end of a dog specifically, would have a tail in there, and that's described as caudal because cauda means tail. So in this case, when he is on four-legged or she is on four legs, the dorsal would be equivalent to superior, ventral would be equivalent with inferior, rostral, anterior, and caudal, posterior. If he would stand up, however, now the rostral will be superior, the caudal would be inferior, ventral would be anterior, and the dorsal would be posterior, as you can see. But ventral and dorsal will always describe something closer to his belly or her belly, and the dorsal would be closer to his back. The rostrum will be always related to his nose end, and the caudal would be always close to the tail. Now, a standing up person, like us, having their vertebral column and the spinal cord in a vertical position, would have a similar description. The ventral closer to the belly, ventral, and in this case that would be the same as anterior. The dorsal would be the same as posterior, and we describe caudal, inferior, and rostral, superior. However, our brain is positioned here in the skull, and its main axis is at an angle to the vertebral column, a little bit more similar to how the dog stands on four legs. So here we will talk about the ventral, and the ventral, it would be this one because this is closest to the belly. So ventral, closest to the back would be dorsal, closest to the beak would be rostral, and at the back is the caudal. So in here, please note that the dorsal would be the same as superior, the rostral would be same as anterior, ventral would be inferior, and caudal would be posterior. When we describe the brain, this would be described as the dorsal surface, sometimes superior, and this would be the ventral surface of the brain. Dorsal, ventral.